There are three things you need to know for a concussion diagnosis, and none of it requires anything fancy or expensive. That $3,500 fMRI, unnecessary. I have this conversation almost every day with discovery calls with patients, with people in the concussion space. And so there's three things you need. We need symptoms, we need vestibular visual screening, and we need an exercise tolerance screening. And so to go through that, we need symptoms. Symptoms are not alone enough to diagnose concussion. They're enough to suspect it on the sidelines. If an athlete gets hit and they report headache or dizziness, we're going to pull you off and assume a concussion. But later in the office, that's not enough to assume. We need a certain number of symptoms and a certain severity of symptoms to consider a diagnosis likely, and we need a mechanism of injury. So you need to get hit, you need a certain number of symptoms. That's step one. Step two is called a vestibular oculomotor screening. Vestibular, oculomotor, how the eyes move. And so if we can provoke symptoms on that, we're about 50% confident that you had a concussion. We got to pair that with the symptoms and the mechanism of injury. Now, the last kind of lie detector test is you need exercise tolerance testing. This is done through a Buffalo concussion treadmill test. You can also do this there's modifications for a bike, there's different ways, but we need to assess your exercise tolerance, your autonomic tolerance, your ability to distribute blood flow at appropriate times at different intensities. What we find is that in concussion, you can't do this. And this is what your fMRI shows. If you go to these clinics that charge you $3,500 and they say, oh, your blood flow is not going to this area or that area, we see that in concussion, and that's why we do the Buffalo concussion treadmill test. You need those three things. It's a clinical diagnosis at this time. You need a mechanism of injury and the symptom history. You need vestibular and oculomotor symptoms, and you need exercise intolerance. You don't need all of those, but those are what we use to rule them in. So we got symptoms, probably likely. We got positive symptoms on a vestibular oculomotor screen, probably likely. You can't pass an exercise tolerance test, definitely have a concussion. And what's cool about that vestibular oculomotor screen is if you don't have symptoms, you probably don't have a concussion, you probably have a neck injury.